Tikas Klasakobi, Gly American Heart Association UAE Heartsaver CPR. CPR cardiopulmonary resuscitation is one of those skills that can serve you in any situation for life. Once you know it, you've given yourself a remarkable gift. You've also given those around you peace of mind that, if someone were to collapse nearby and stop breathing, you could step in to save their lives while you wait for paramedics to arrive. It's far better to do something than to do nothing at all if you're fearful that your knowledge or ability aren't 100% complete. Remember, the difference between your doing something and doing nothing could be someone's life. It's easy to learn. CPR doesn't require years of medical training to learn. In fact, it most often takes a single class through a certified organization, like American Red Cross US, or St. John Ambulance Canada, that will train you in the technique. For others, their professions require them to be certified in CPR, often accompanied by AED training and first aid, so a class is necessary to ensure you have the proper paperwork to confirm your certification, and means you should re-certify every 2 to 3 years. Increased chances of survival. Once the heart stops beating, it prevents oxygen from getting to the brain, which can be devastating in a very short period of time. Performing CPR provides oxygen to the brain and other vital organs to give the patient the best chance of recovery after EMS takes over. Increased confidence. CPR training, you gain the skills and knowledge necessary to perform CPR and use an AED with confidence, and to make good decisions that can help someone in distress. During an emergency, it's often those people near the victim who provide assistance before EMS arrives, and with training, you're prepared to use life-saving techniques and drastically improve outcomes for patients long-term. Save someone you care about. That means that you're more likely to use your CPR skills to help someone close to you, like a friend or family member, than assisting a stranger. Many people assume that SCA only happens to the elderly or sick, but it can affect anyone as a result of heart abnormalities, external causes, drowning, trauma, electrocution, drug overdose, etc., or medical causes such as inflammation of the heart muscle due to infection. You get to use life-saving technology with the invention and improvement of AEDs, automatic electronic defibrillator. Training for them is often included with CPR and first aid. AEDs are portable machines, found in most public places, and are used to deliver an electric shock through the chest to the heart, to re-establish a normal heart rhythm. Whatever your reason for choosing to learn CPR, it's always a good decision, and you can even get together with family and friends for your training so that you are all better prepared for unexpected emergencies. When you encounter an adult who may have had a cardiac arrest, take the following steps. 1. Make sure the scene is safe. 2. Tap and shout. Check for responsiveness. 3. Shout for help. 4. Phone your local emergency number and get an AED. 5. Check for normal breathing. Before you begin the CPR, check the environment safe for the person. Is the person conscious or unconscious? Tap or shake his/her shoulder and ask loudly, "Are you okay?" If doesn't respond, call emergency number and get AED, if one is available, and begin the CPR. As soon as an AED is available, deliver one shock if instructed by the device. Chest compresssions. 1. Put the person on his/her back on a firm surface. 2. Kneel next to the person's neck and shoulders. 3. Place the heel of one hand over the center of the person's chest, between the nipples. Place your hand on top of the first hand, elbows straight. 4. Use your upper body weight as you push straight down on the chest at least 2 inches. 5. CPR performed 30 chest compression until there are sign of movement. Airway, open the airway. If you are trained in CPR and you've performed 30 chest compressions, open the person's airway using the head tilt, chin lift maneuver. Put your palm on the person's forehead and gently tilt the head back. Then with the other hand gently lift the chin forward to open the airway. Rescue breathing. 1. With the airway open, pinch the nostril shut for mouth-to-mouth breathing. 2. Prepare to give 2 rescue breaths. First rescue breath, watch to see if the chest rises, if not, give the second breath. If the chest doesn't rise. Third is 30 chest compression. Note, 2 rescue breath plus 30 chest compression is considered 1 cycle. 3. Resume chest compressions to restore circulation. 4. As soon as an automated external defibrillator (AED) is available, apply it and follow prompts to use an AED. Turn it on by pushing the on button. Once the AED is on, you will hear prompts which will tell you everything you need to do. Place the pad on the chest. Follow the instruction that you will see in the label of the pad. Let the AED analyze the heart rhythm. If the AED advises a shock, it will tell you to stay clear of the person. Make sure that no one is touching the person just before you push the shock button. 5. If the person continues to be unresponsive, continue CPR until there are signs of movement or emergency medical personnel take over. Thank you for watching. Please like and subscribe. Keep safe, strong, and healthy.